Pleasant good night to everyone. My name is Patsy Wiley, Chief Health Promotion Officer in the Ministry of Health, Wellness and the Environment. I want to thank you for coming out at this short notice. We are not accustomed to doing this, and this tells you that it is a matter of urgency. At the head table, we have Honorable Robert Luke Brown, our Minister of Health, Wellness and the Environment, our Chief Medical Officer, Mrs. Simone Keyser Beach, and our Permanent Secretary, Mr. Cuthbert Knights. I now invite our Minister of Health to make a statement.
Good night, everyone. Thank you for being here. And let me just first of all echo what was said by our chairperson in thanking you for being out here at such short notice and for also being here at this hour of the night. Normally people are preparing to wind up a day at this time, but you are here covering a press conference at the Ministry of Health, Wellness and the Environment. Just to start with a general announcement, earlier today, the World Health Organization declared that the global outbreak of COVID-19 is a pandemic. There has also been a significant development in our country that I'd like to announce tonight. We received confirmation earlier today that St. Vincent and the Grenadines has recorded its first case of COVID-19. It is what is described in the literature as an imported case. The disease appeared in a Vincentian female who had traveled abroad to the United Kingdom, otherwise known as England, which is known to have cases of COVID-19 and returned home on March 7, 2020. The patient has been informed of this status. She is fully cooperating with the ministry. In fact, the patient voluntarily reported her symptoms to the ministry on March 10th and has since then been in isolation at home under the care of competent health professionals. The symptoms are mild and we expect the patient to make a full recovery. Based on the patient's travel history and symptoms, health professionals suspected COVID-19. These suspicions were confirmed by laboratory testing at the Caribbean Public Health Agency laboratory in Trinidad and Tobago. The results were received today at approximately 5:20 p.m. The patient and her family members have already been informed. The patient contracted COVID-19 as a result of travel. The ministry is taking all necessary steps to prevent its local transmission in our communities. A health team has been dispatched to the home of the patient to assess the situation and to initiate public health measures. Contact tracing to determine all the persons with whom the patient may have been in contact and therefore who may have been exposed to COVID-19 was initiated. The ministry is in an advanced state of setting up an isolation center in Argyll. 2 public hospitals can be used as isolation facilities. The equipment necessary to allow us to perform in-country tests for COVID-19 is being ordered. The ministry will carry out a thorough health education campaign based on coronavirus in the communities, schools, churches, and other groups. We would be relentless in our efforts to reach every member of our population with relevant information. Systemically, the ministry has assessed the readiness of our health facilities to deal with a possible increase in demand for services. 2 is strengthening the state of equipment and supplies with a view to addressing any gaps. There is currently an adequate stock of personal protective equipment in country for our health facilities. Additionally, an adequate supply or store of respiratory medicine for the next 3 months is on hand. 3, the ministry continues with the further training of healthcare providers, including ongoing sensitization and training of personnel at airports and seaports. The ministry understands that the public may be concerned and that there is an element of uncertainty. As you may be aware, there is currently no vaccine and no specific antiviral treatment against the virus. The best way to prevent yourselves from being exposed to COVID-19 is to adhere to standard and well-known measures for the prevention of infections. Practice good hand, cough, and sneeze hygiene. Wash your hands regularly. Avoid touching your face, eyes, nose, and mouth with your hands. That is how the virus is spread. Avoid close contact when possible with anyone showing symptoms of respiratory illness, such as coughing and sneezing. keep a distance of at least 1 to 2 meters, that is 3 to 6 feet, from such a person. Non-essential travel is discouraged. You should also employ the following practices. Frequently clean hands using soap and water, or use an alcohol-based hand rub if your hands are not visibly dirty. When coughing and sneezing, cover your mouth and nose with flex, elbow, or tissue. Throw away tissue immediately afterwards and wash hands. If you have fever, cough, or difficulty breathing, seek early medical care and share previous travel history with your healthcare provider. This government has been preparing for this possible development through activities under the international health regulations. We have been enhancing surveillance at all ports of entry, informing healthcare providers about proper response protocols, disseminating up-to-date information to the general public, international travelers, and public health partners. For additional information, I would encourage you to visit our website at health.gov.vc or call 1-784-457-2586. We would overcome the challenges posed by COVID-19 together. The Ministry of Health, Wellness and the Environment and the wider government of St. Vincent and the Grenadines will continue to keep the press and the public up to date on all developments. Thank you.
Thank you very much, Minister. We will now take questions from the media. In the room, we have with us, who are able to respond to your questions, our Chief Medical Officer. We also have Miss Jose Davy, our Infection Control Specialist, our Health Disaster Coordinator, Mrs. Donna Bascom, and our Medical Epidemiologist, Mrs. Shamin Bailey Rogers.
Good evening, everybody, and thanks again for coming. So the individual, because we would want to protect the individual, we would want to assure Vincentians that the individual is safely in an adequate facility in keeping with their condition. This person is healthy, is not ill. When I say that in terms of the person is not in any significant respiratory compromise, the person is comfortable, the person is not short of breath. So this is one of the cases of a mild COVID-19. Remember, we talked about 80% of persons having mild infections, and yesterday and earlier we also indicated that the majority of cases will be managed at home. So at this time, for the safety of the patient, we want to reassure you that they are safe, they are well taken care of, they are in a secure place, but we will not be able to say which community that person is in. Okay?
Okay, Larissa Kidd, SBGTV News. I know you mentioned that you don't want to announce or say what, but are you at some point will be testing the family members at some point?
Okay, so we will test persons who meet the criteria for a case, okay? So we are not going to test every contact of the person unless that contact exhibits symptoms and signs of COVID, all right? The person had minimal symptoms. They presented on the 10th, that's yesterday. Prior to that, there were no symptoms. There was nothing to suggest any sort of coughing to say they were spreading this in terms of massive coughing exposing persons, okay? The person had minimal contacts in terms of their family members. As soon as we knew of the case, we implemented quarantine for the patient to ensure that there was no other possible contact, okay?
Good evening, Kenton Chance, Eyewitness News and the Caribbean Media Corporation. You said that the patient exhibited no symptoms?
I said minimal. But when I said no symptoms at the time of So the symptoms developed yesterday.
Can I ask what sort of symptoms this person displayed, why they decided to seek health care?
A cough and a fever.
Are you in a position to say the age or age range of this person?
It's a young adult. So, a young adult in the age range of 30, between 30 and 35. So not in the, again, not in that high risk over 60 age group.
And is this person of Vincentian National?
Yes, this person is a Vincentian national who traveled to England for a meeting and returned on the 7th, was asymptomatic throughout the flight, developed no symptoms at all, and presented with symptoms on the 9th, on the 10th, sorry, Tuesday.
You said that the ministry would the health system would not test persons unless they present with symptoms. What are those symptoms? At which point would you test?
Okay, so just as we did with the 3 individuals under quarantine a few weeks ago, so they presented with a mild fever at that time, and we decided to test. So we are looking for, so we have a confirmed case. We are aware of their contacts. If one of those contacts develops a fever or develops a cough or any sort of respiratory symptoms, they would then meet the second case definition. Remember, we spoke about 3 case definitions. One would be somebody who has a fever and respiratory symptoms, whether that is a cough, a cold, shortness of breath, and traveled from an area. So this first person, she met those 3. She had a fever, she had a cough, and she traveled from the UK where there is spread. So she met the case definition. That's why she was tested. If we then have somebody who is in contact with her, develops a fever and a cough, that person would meet the second case definition, and that person would be tested. Okay?
What assurances can your ministry, does your ministry want to take advantage of this media audience to give to the public? What advice would you like to give?
Okay. So we want to reassure the Vincentian public that we are making every effort and we are ensuring that we keep the patient safe and we keep others around, immediately around, and even wider safe. So we are implementing quarantine for not just the patient, but also her immediate contacts. So all of her immediate contacts are also going to be under quarantine for 14 days and strict observation. So the patient is going to be under strict observation to ensure that the person has what we expect to be a completely mild illness. We would also be monitoring the contacts closely to detect as early as possible if any one of those contacts also develops signs and symptoms, and we would immediately test those persons. Okay, we are also doing contact tracing, not just for the immediate contacts. We are also looking into every place that this person went to. Okay, even though it was limited, we are still going to do contact tracing to determine who this person was in contact with, what measures we need to do to take every precaution. Okay, so we will do that. As I said, the person is safe. My staff is safe. I was extremely, I impress upon my staff in terms of them following all of the procedures. So we provided my staff with personal protective equipment. We ensure that everyone who went to see the patient, was trained and capable of providing the care they needed to provide and at the same time to protect themselves. So that would be our assurance, to protect the staff, protect my healthcare workers, and to protect Vincentian general public.
Should Vincentians go about it? Should residents of St. Vincent and the Grenadines go about their business as per normal?
Yes, but I need Vincentians. So I know we have had a lot of concerns about cruise ships. This case is similar to the case in Jamaica, where the person is a local who is coming from a country which has not been identified. That's the nature of a pandemic. A pandemic means they spread throughout the world. So any country at this point is a potential source of infection. So what do we need to do? We need to be very aware of ourselves and all of our brothers and sisters. And so we are aware, do you have a cough or cold or flu? Is it unusual? But how do I protect myself from getting that? And as we have been saying, it seems basic, but let us not touch our faces. Let us make sure we are cleaning our hands. We are cleaning surfaces. That is the way in which we would attempt to keep this under control. The aim, I'm not sure if some of you saw on Facebook, there's a graphic of a curve, an epidemic curve, where if we have decreased contact, you slow the curve, you diminish the peak so that you don't have a major influx of patients which will strain the healthcare system and all of your services. So the intention is, the attempt is to slow this curve. And the only way we are going to do that is if we're going to decrease the rate at which we spread. And the way we do that again is basic hand hygiene, basic, if you cough in your elbow. If you cough in your tissue, and you discard your tissue immediately. Okay?
Kristen Oliver, Extreme FM. My first question, the contact tracing will also include passengers on the flight?
Okay. So this is a topic we spoke about much earlier on. Okay? So the research has shown that if someone who is positive for a corona-like virus is not symptomatic, meaning they're not coughing, they have no fever, there's no obvious display of illness, that the benefits of doing contact tracing for the other persons on that flight are minimal, meaning that the risk to the other patient, other passengers, is minimal. However, we will still make every effort to alert the persons sitting 3 rows in front, 3 rows behind that person, so that they are aware. As you know, when you sit in the plane, you're given a number these days. Sometimes we move around, but this is information that is readily available.
Okay. Another question. Is it too soon to say what will happen to large gatherings?
So this is something we are also looking at. So this is something we have been contemplating. We have gathered the necessary research in terms of what is the likelihood, what should be the triggers. As it is now, we are looking at our numbers. We are looking at gatherings coming up. So we have an imported case, meaning that this person did not contract their disease in St. Vincent. They contracted their disease in the United Kingdom. However, we will continue to monitor, to test as necessary. So, as we said last night in the other gathering, if we move from imported case to local transmission, which means this imported case has passed this disease on to somebody locally, that's local transmission. And then if we move to community spread, where you have other persons in the community showing up sick without any obvious index case, initial case, those are 3 different situations. So now we are at the first stage. We're at the stage of an imported case. And we are going to look at the risk. How many persons are we thinking about when we talk about mass gatherings? Are we thinking about an entire Victoria Park of persons, or are we thinking about going to church? So we need to be aware of the differences. And at this point, I would not recommend saying that there are no mass gatherings. However, we all need to be very aware of what we're doing. So if you go to church tonight and Auntie is coughing, you might want to remind Auntie that she needs to cough in her tissue and discard it. Dr. Davis didn't tell Auntie to go home. But so advise and we wash hands. And if you are sick, you should stay home. So if there's someone who is sick with the flu, if your child is sick, don't send your child to school. That is general for any sort of flu. If you are sick and you work in an office, call and say, I am not well. And that way we would decrease the spread of whatever you have, whether it's H1N1, which we have circulating anyway, normally, or influenza B.
Can you give us the number? You said call, the number to call.
No, I meant call your office
No,
and tell them, or before that.
Call the health number. What's the number?
Okay, so we have circulated the numbers of the clinics in each area, okay? So we can do that again. It's on our Facebook page, it's on our government website, because in each we have 39 health centers, 5 district hospitals, and the polyclinics. So what we did is we sent the numbers for the hospitals, because the district hospitals, there's always someone there. So you call that number and you inform the person if I am feeling sick and what my history is like in terms of a flu-like illness. Okay? Okay. And I'm just being reminded, I'm not sure how many persons still have a directory, but it's in the blue pages. You have all the government clinics, hospitals, and facilities there. Okay?
Jennifer Richardson, the API.
Yes.
Now that we have a confirmed case, an imported case, albeit, would this be the trigger for us to see the immigration officers and health workers at the airport start wearing perhaps masks or gloves or anything like that?
No.
As a means of protecting themselves?
The risk to the immigration officers, the port health officers, is the same now as it was yesterday. Why? This is a case who has come in, okay? We have said before, what does a mask do? The mask is best used for the person who is ill, okay? The mask in terms of protecting an immigration officer who is away from the person who is coming in, who on the flight had no sorts of cough or cold, who when they come in, we have the signs up, are you coming from an area, and then you turn right to the nurse who does her assessment, who checks her temperature, who does a clear history, okay? The nurse at the triage, at the emergency room, must wear a mask. And that is something we had advised weeks ago. Why? Because anyone can walk up to that nurse and without any sort of guides as to what might be happening. As we said, we have implemented with the airlines. We have given the airlines an extra form which clearly asks the air hostess, the steward, to document any person who is coming off, who is on that flight, who has exhibited any sort of illness, cough or cold. Okay?
Final question from me. Is the Evesham Health Center back in regular use, full regular use?
I would have to. There's still repairs. There's still repairs going on.
Repairs are being done and being finalized as we speak.
Yes. Okay?
Captain Chance again. Can I ask, how soon is the isolation facility expected to be operational?
So I would go ahead.
We don't have a clear timeline right now, but we are as Thanks for the question. Just to say that we don't have a clear timeline on its precise completion date or precise readiness date on the isolation center, but just to say that we're going to try to get it done as quickly as possible. This, of course, is an additional impetus for us to do so. We had a press conference last week, Friday, at which we disclosed the state of or the stage of our plans in respect of that. Since then, we've taken several steps forward, and we're looking to carry out the retrofitting works at a cost of $100,000. I believe that these things would commence very soon, in fact, this week, and hopefully in a couple of weeks we'll be in a position to use it properly for the purpose intended. So as soon as possible, essentially.
Just one final question from the CMO. Can one pass on the virus if he or she is not exhibiting any symptoms?
So there have been some cases reported where there are persons who can spread the virus and not be symptomatic. There are some reports of that. Dr. Davy, do we want to say anything beyond that? So there are just some reports of that, but that is not the typical way. Okay?
JP Shimon with Asbot News Network. I'm just wondering quickly, the PAHO announced that some jurisdictions do not quite have a strong enough health systems to take care of the pandemic that we're now faced with. I'm wondering if St. Vincent and the Grenadines is such jurisdiction that is being buttressed, so to speak, by PAHO resources.
Okay. Please remember that PAHO covers North America, Central America, South America, and the Caribbean, including Haiti. Okay? The health system of St. Vincent and the Grenadines is strong. Our primary healthcare system has recorded significant, consistently very strong figures in terms of the guides. When you judge a healthcare system, you look at the perinatal mortality rates. You look, meaning how many children die in the first 28 days of life. You look at the maternal mortality rate. Over the last 2 years, it's been 0, no maternal deaths. We look at the number of persons the proportion of children who are immunized, and we are above the recommended levels. In terms of the sustainable developmental goals, we have surpassed most of those. And if we haven't surpassed those, we are near to them. St. Vincent's healthcare system is strong. The buttressing that PAHO was talking about in some places. So, for example, Haiti was given capacity to test in-house. Okay? We in St. Vincent and the Grenadines, we have adequately competent, trained staff. We have a guaranteed, secure method of testing. We have excellent potable water. We can wash our hands and be confident, okay? I do not think that PAHO was referring to St. Vincent and the Grenadines when they made that statement, because we do not meet, rather, let me put it another way. We far surpass the requirements, the indicators to say that we have a strong healthcare system. Okay?
Thank you for that response. Also, some jurisdictions are reporting that they are instituting public cleaning or cleaning public areas, bleaching, these sort of things. Is that part of the response for St. Vincent at any point?
Which ones?
some jurisdictions are reporting that there would
Which
be
jurisdictions?
New York City.
Okay.
Yeah. So that if you get on the bus and you smell bleach or such, it's just part of their response.
Okay. So, as we have been telling persons, clean the surfaces. We have been describing how many parts of water to bleach. 1 in 10. So 1 part of water, 9 parts of bleach. That is to clean your surfaces. Later, on Monday we will meet with the taxi drivers and the van drivers, hopefully. Shanika, Ismaili, yes? And we would be advising them, taking this opportunity to reinforce basic hygiene and basic keeping your vehicle, your transportation tomorrow. So we are meeting with the Hotel and Tourism Association tomorrow, and we would have some of the taxi drivers then, and we would reinforce that, okay? We know that our cleaners who clean Kingstown in the wee hours of the morning, they do an excellent job, okay? But we are going to remind everybody, because it is a shared responsibility. We are all responsible for ensuring that our hands are clean, our surfaces are well clean, so that if you walk into the van tomorrow and you smell bleach, it will be just that we are reinforcing, and the persons have gotten the message to ensure that their van is clean. Okay?
Principals on Monday.
Okay, and also the teachers, we're dealing with the principals on Monday also to reinforce. Again, we have our children in the schools to ensure that those schools are kept nice and clean.
Crystal from Extreme FM. First, America has just announced that they have halted travel from Europe to US. Are we going to do the same?
All of Europe? No. No.
BBC.com. I'm getting it from. BBC.co.
Who you getting it from?
It says Trump halts travel from Europe to US. Has announced sweeping new travel restrictions on Europe in bid to combat the spread of a coronavirus. Would there be any travel restrictions going forward?
Sorry, just to mention that I think you're referring to a developing story that will need to be assessed before we could really comment on it reasonably. But at the moment, we have in place quarantine restrictions for persons traveling from certain countries, including countries in Europe, such as Italy, as a case in point. And there's no intention at this moment. I mean, of course, it's an evolving situation and we assess things as they develop. There's no intention at this moment to carry out a broad-based ban on travel from Europe or from any other particular part of the world. You see, it's just a case of us trying to, as best as possible, manage the risk that is associated with COVID, and just to keep everybody in the loop on what we're doing in terms of risk management, make sure that when there's information that comes to hand, we share that information with the public. You understand that we are being very transparent with any news that we might have, so you could more or less take care of yourself and take care of your health. So the wide-scale travel ban is not something that is really on the table at this moment, but of course we assess the situation as it evolves to make sure we do our best for risk prevention. Just to remind persons, the point was made in relation to this case that it is an individual who is exhibiting mild symptoms, and that is consistent with what you would see in most cases of COVID-19, mild symptoms. So we reiterate that 80% of the persons who get COVID-19 will only develop a mild version of the disease with limited symptoms. And it's only in a case where you're in the 20% group that you might have a more severe version of it. But in all instances, in most instances, mild or severe, you're expected to fully recover. And we expect full recovery in relation to this particular case. And we note that only persons who are very old, and there's by very old we basically mean over 80, and who have underlying health conditions are really especially vulnerable to this. And this makes it, as far as its epidemiological profile is concerned, something comparable to flu and other ailments that we have a lot of experience with. So what we're saying here is that we could draw on our vast experience in some of these other areas to make sure that we try to keep this COVID-19, this coronavirus, in check. That's what we're doing. That's why we're reinforcing some standard practices that we have known almost from time immemorial that could be applied to minimize the spread of infection. So we're really going to commend that to you and the public, and to assure you that we will continue to monitor the situation with a view to best manage risk, protect your safety, and at the same time ensure that we could continue with our regular lives in as best a way as possible. Thank you.
Lavon Phillips, Nigeria. This question is for the Minister. You said that you do not have a specific timeline as to when construction or retrofitting for the facility will begin. Now, the fact that we have one confirmed case, and chances are, you said that the immediate members of the family, of that particular family, are quarantined. We have no idea as to who else got in contact with that individual and their family members. Chances are we will have to start at some point, so we need to know exactly the time frame when that will begin, just in case, God forbid, that the outbreak gets terrible.
Yeah. Well, I'm not sure that it is quite right to say that we have no idea on the persons who this individual was in contact with. In fact, I think our statement suggested that we have some idea and that we have initiated contact tracing, even to the point where we said that we have the information in relation to the flight available. So we have an idea. And we have a working idea. And also the question had to do with the timetable, not so much for the commencement of work, because work has commenced on the isolation facility that we discussed in Argyle, but for the completion of work. I wanted to be able to be informed by the persons who are actually carrying out the work on a particular, on the deadline. I made the commitment that we're going to get it done as soon as possible. And you could rely on us to drive that process forward to its conclusion. But I wanted to have the benefit of a direct date or recommended date or deadline date from the persons involved in the work before I report that publicly.
Minister, that specific location in Argyle, is it, a place where it's a residential area or?
Well, we think it to be a very suitable site. In the last press conference we had, we mentioned that it was basically away from houses and residences and the residence of anyone, and it's largely in a remote area that is behind the airport. So it's suitable, and we're hoping to get it up and running as soon as possible.
Minister, when your ministry contracted those works, did it have a timeline by which you wanted it to be completed?
Yeah,
And what is that date?
we have preliminary timelines for the completion of the project, but again, in light of this development, I think it is prudent for us to be guided in this new situation by a review of all dates which are on the table before we make a public statement on it.
What was that preliminary date?
Well, I think that we should be guided by the further information before.
I just want to, sorry if I can jump in and just make a statement. I know everyone is very anxious about, the completion date. But let it not be that you think we have no capacity to isolate someone and manage them in a sufficient way. We do have capacity. Our aim in terms of the facility at Argyle is to expand that capacity and to have a unit that is separate, okay? However, if today, if that patient had been found to need hospital care, we have a facility. So let us not think that we do not have the capacity to isolate in a healthcare facility adequately, okay? It is just that we recognize that we should have additional capacity in a separate location, and that is what we are aiming to do. We have capacity, and we have capacity to manage more than 2 or 3 persons as of today, okay? That's one thing. Another thing I just wanted to go back to a question that you asked, Crystal, is that the U.S., you said the U.S. is banning, and I know it's a developing story, banning flights from Europe. We only have direct flights from Canada and the USA at this point. And actually, because of that, not having those direct flights from some of those other places, that has sort of given us almost like a sort of a buffer. Okay, so the fact that the US has decreased flights from Europe adds to our buffer a bit. But let's understand this. We have gone from epidemics in individual countries to a pandemic. The nature of a pandemic is that you have disease throughout the world. So even if you were to, unless you're going to shut your borders completely, as Italy has done, you're not going to be able to limit all access to your home, okay? That is why we stress again that along with border control measures, this is why WHO emphasized about 2 weeks ago that emphasis, WHO did it, PAHO did it, CARPHA did it, that the emphasis needs to be on the strengthening of your capacity to deal with cases, to move away from the idea of preventing importation to managing cases in-house. And I'm not sure if you noticed, but that is what we have been moving towards. Building capacity in-country to deal with cases, because when you went from an epidemic to a pandemic, the chances of preventing importation are decreased. Okay? I'm not sure if you heard, Guyana also confirmed their first case today. So that's Guyana. Jamaica had a second case. We have our case. And I'm sure that over the next few days, other islands in the region will have their first cases. Why? Because that's just the nature of a pandemic. So your focus needs to be in terms of reducing spread in country and managing those cases in country adequately. Okay?
Just one follow-up as it relates to the most at-risk population here, the persons with underlying issues and the more mature individuals. Are there any specific emphasis being placed on educating them as to what they should be doing, how they should be managing preparation processes?
Okay, so I'm going to let Dr. Josie Davy, our infectious disease specialist, deal with the clinical and that sort of information. Ms. Wiley can also supplement that.
Good night, everyone. Yes, for the persons at risk, we want to be paying special attention to our diabetics, because being diabetic, you're already immunosuppressed. Also at risk would be the elderly, as we heard, persons with high blood pressure, and persons with cardiovascular disease. And this rate increases because of the pneumonia that comes with COVID-19. So those are our most at-risk population. The children under 9, thankfully, have not been so affected. We expect children to be severely ill with this disease, but this is not happening, and we thank God for that. So what do you do to keep yourself safe? We've been saying it for the last 6 weeks, I believe. 7, it's been a long time. Everybody in this room is probably tired. So, proper hand washing techniques, and there's a video circulating as to how to wash your hands adequately, properly with liquid water and soap. Don't touch your face. Cough etiquette, cough into a tissue discard. It sounds like almost a record now, everything that we have said, but we have to keep saying it. If you're diabetic, do your best to keep your blood sugars under control. Hypertensive, take your medicine. This is not the time to leave it in the cupboards. Please take it. If you have a cardiovascular disease, ensure that everything is under control. Thank you.
The CWSA announced about 3 days ago that they will be cutting water supply in some areas during some period of time. Will this be suspended? Because we're preaching about washing hands and proper hygiene and stuff, and water plays a very important role in that.
Well, I'm not sure that the actions proposed by the CWSA would put you at risk of not being able to wash your hands as regularly as you need to. But we could also, out of an abundance of caution, check to make sure that there's not too much of a disruptive effect to the water supply to the point where personal hygiene goes out of the window. But I don't foresee that to be the case based on what I know now. And I'm reminded that just in case you suffer the inconvenience of not having water when you want to wash your hand, then please resort to hand sanitizer, hand rub. That is consistent with the specifications provided by the ministry. There's a suggestion that strong rum, after all, might have some use. Instead of drinking it, you could use it on your hands. Thank you.
Let me just add, in addition to what Dr. Davy mentioned, because you asked a question about our senior citizens, we have had the support of Dr. Gerald Thompson, and he has met with the persons living with HIV, so that education is going on. Also, we'll be meeting with our diabetics and hypertensive. There are associations throughout our health districts, so we have started and we're going to continue to work with them. And we are also relying on you, as yesterday you were told, that you have a captive audience. In any minute, you have hundreds listening to you. So we are relying on you to help us to reduce the spread of this disease. Yeah.
Forgive me if I missed the figure, but what's the total number of persons in quarantine?
Okay, so as of yesterday, it was 0 because the last person finished yesterday. And now we would be up to 1 isolated person and 3 quarantined persons. Okay?
We take the final question.
I know last time when you had a press conference, you mentioned that the PSR equipment to test for coronavirus, in Boston recurring, but when exactly this equipment should be in country?
We'd have Elliot from the lab.
Just to make it a summary response at the press conference, we did indicate that we had a time frame for the setup of this equipment, and that time frame was by the end of this month, March, and we're sticking with that time frame. Note, however, that we do not face a constraint as far as testing capacity is concerned, because we have a very efficient testing arrangement currently in place with the Caribbean Public Health Agency lab in Trinidad and Tobago, which was used in this instance to get the results from the case that has been confirmed. Notwithstanding that, we're still working actively on getting the capacity in place, in-house, by the end of this month. And of course, if we could get it tomorrow, we will push to get it tomorrow. Thank you.
Thank you very much, Minister, our Chief Medical Officer, and the support technical team. And let me thank you, the media, for coming out at such short notice. And I want to re-emphasize the point that we are relying on you to help us. And if there are any new developments, you would be informed. Thank you very much, and have a good night.